You're listening to episode 249 of MitoLife Radio. I'm your host, Matt Blackburn, and today we have Dr. Scott Sherr returning to the show. He is one of the owners of TroScriptions. They're mostly known for their methylene blue troches, which are sublingual little squares that you hold between your gums and your cheek to get it to the brain faster. One of their products called TroCalm I've really been enjoying for the last few years. And I think the last few years has been stressful for everybody. So we need as many tools as we can to stay chilled out. It contains a combination of substances, some cannabinoids, kava, but what he focuses in on this show is nicotinol GABA. GABA's a inhibitory calming neurotransmitter, and in that supplement it's bound to vitamin B3, which I'm a big fan of. I sell niacinamide form of vitamin B3 under MitoLife, and in combining it with B3, it actually reaches the brain. So Scott explains that in the show and why normal GABA supplements don't work. And he also talks about their new product called TroZZZ, which is their sleep formula. And the really interesting ingredient in there called agarin from the fly agaric mushroom. So in this show, Scott talks about where 80% of the brain's neurotransmission comes from. A lot of people focus in on dopamine when that's actually a small part. He talks about glutamate, how that's the precursor to GABA and the nutrients that are required to convert it into GABA. Talks about the effects of alcohol, benzodiazepines, barbiturates, and other substances on GABA receptors. The substances that are GABA boosters, the difference between GABA A and GABA B receptors, narcolepsy, and the interesting effects of GHB, the effects of honokiol, agarin, cordycepin, adenosine, and other ingredients found in the TroScriptions products. This was a really interesting show. It's always fun to talk to Scott. He was pressed for time, so I didn't get to listener questions, but there's still a ton of information in this show. So enjoy. Here is Dr. Scott Sherr. All right, Dr. Scott Sherr, welcome back to the show.
It's good to be back with you, Matt. It's been some time. Welcome back to Idaho since I last saw you.
Thank you. Yeah, it's been we've been overdue. I really enjoyed our last few chats. We did one on hyperbaric oxygen therapy, and then one all about methylene blue. And yeah, it's always fun to chat with you. And you have a lot of experience working with patients and trying out different combinations of things. So it's pretty awesome. You're in a field called it's health optimization medicine, right?
Yeah. So we have a nonprofit organization training doctors and practitioners on how to optimize health, and it's a company that was started by a colleague of mine. His name's Dr. Ted Achacoso, and Dr. Ted's the founder of Home Hope. So that's the short of health optimization medicine and practice. So it's a 7-module certification course for doctors and practitioners that are looking to set disease aside and conditions aside and really just focus on the health of the cells and the gut and looking at optimizing metabolism or something called metabolomics. I think we touched upon this a little bit in our previous talks as well. And out of the nonprofit came the company TroScriptions, which was developed to help people now along the path of health optimization, which can take a while for people. As I think you've experienced yourself, Matt, things don't happen overnight in the sense of making you feel better if you're not feeling great. It can take months to sometimes years when you're optimizing gut function and neurotransmitter balance and sympathetic and parasympathetic balance and your exercise and things like that to really start feeling better. And so TroScriptions was developed to help people right now, to help along that path and make it a little bit easier. So help you right now with focus and help you right now with mitochondrial optimization. And those are our methylene blue products, our Just Blue and our blue carnitine. And then we've now developed several in the world of my favorite neurotransmitter, GABA, and helping modulate the GABA system for stress, for anxiousness, and for sleep.
Awesome. Yeah, I've been taking TroCalm for, I think, about 2 years now, off and on, and it's a great tool to have in the tool chest, especially as an entrepreneur. If you're juggling a million phone calls and tasks and responsibilities, it definitely takes the edge off. I mean, especially if you take a full one. I'll often do, just do a full troche, and you definitely feel it if you do that.
Yeah. So, and that's been the experience. I mean, overall, TroCalm has been out on the market now for a couple of years, and it is a fantastic synergistic combination of four ingredients. One called nicotinol GABA, which is a vitamin B3 attached to a GABA molecule, which I'll get into in a minute. Also have something called kava. Most people have heard of kava before. Kava is also affecting the GABA system in various ways. Then CBD and CBG, which are non-psychoactive cannabinoids that help modulate the endocannabinoid system, so our body's own internal cannabinoid system, let's call it. It was named after the cannabis plant, but we have it internally already, ladies and gentlemen. Most of you probably know that already. But it's basically a homeostatic system. It's a system that helps with balancing. It's one of these gigantic meta systems that are in our body that it's kind of affecting many things all at the same time. But CBD and CBG also affect the GABA system as well. So, and TroCalm was developed so that you could take it during the day and not feel like you were tired. If you took the full troche, you may feel tired. But if you take a quarter or a half, it doesn't typically make you feel tired because we're using a formulation and a version of GABA that's called, as I mentioned, nicotinol GABA. And nicotinol GABA is a vitamin B3 attached to a GABA molecule. And so for those who don't know, GABA is your most important neurotransmitter in the brain that keeps you calm, that relaxes you. It relaxes the firing of your brain. And 20% of your brain's neurotransmission is all about GABA. So if you don't have enough GABA around, you're not going to feel good. In fact, like GABA deficiency, like this is like GABA deficiency syndrome. There's no actual syndrome, but like symptoms of GABA deficiency, anxiety, fear, depression, short temper, phobias, impulsiveness, addiction, schizophrenia, OCD are even associated. And systemic symptoms like IBS and diarrhea, high blood pressure, chronic pain, migraines, allergies, frequent urination, muscle tension, sweating, salt cravings, like a lot of different symptoms are associated with not having enough GABA in the body. And so many of you listening have some of those symptoms. I hopefully not all of those things going on at the same time. I really hope not. And it doesn't always have to be related to GABA, but it's not, unfortunately, on clinician side, as I am a clinician, it's not on our radar all the time that we're thinking about somebody might be GABA deficient with anxiety or depression or poor sleep, for example. We may be thinking about that they're watching too much TV and they're having too much dopamine hits and they're having shitty diets, and all of that may be part of the sort of ecosystem or milieu that's ongoing, but keeping GABA in mind is important. And so, when you're thinking about GABA, you also have to think about its opposite. So in the brain, you have something called glutamate, and glutamate is your excitatory neurotransmitter. It's the one that keeps you on, it keeps you focused. Of course, norepinephrine and does this, and dopamine to a little bit, to some extent, but actually combined. So glutamate itself is 60% of the brain's neurotransmission, and you have 20%, which is GABA. And so you have 80% of it is just those two neurotransmitters, actually. So everybody thinks that like dopamine and serotonin and norepinephrine are running the show, and it's actually not the case at all. Actually, it's actually glutamate and GABA. So, and interestingly enough, in the brain, glutamate gets turned into GABA. So the only way you can make GABA in the body is by turning glutamate, this excitatory neurotransmitter, into GABA. And to do that, you need to be able to have a conversion, or that enzymatic process requires vitamin B6 and it requires magnesium. So ladies and gentlemen, if you're deficient in vitamin B6 or you're deficient in magnesium, and as you know, Matt, many people in this world are magnesium deficient. I think I've heard certain statistics around 60 to 80% of the US population. I don't know if that sounds right to you, but we know that if you don't have enough magnesium around, there's a lot of problems. It's not just conversion from glutamate to GABA, but it's certainly one of the major ones that we see.
Yeah. Conversion of vitamin D. I mean, so many things that people don't think about with magnesium. I think it's 3,751 transcription factors. I mean, it's pretty wild. It's funny you bring up B6 because I tend to watch all the little fear things that go around on social media. And the latest one is B6 supplements being toxic. We're aware of like the potential for neuropathy from, overdosing on B6, but a lot of these
Sure.
supplements have 5-10 milligrams. And I think the messaging right now is like, only do the P5P form. If you do pyridoxine, it builds up in the system and it just becomes toxic. And who knows? My understanding is a lot of these things can break down if you have other nutrients that can make the conversions.
Right. A lot of this, there's so many factors that are at play here, but I think that the key is you have to measure what you need. That's what it comes down to. If you're vitamin B6 deficient, then take vitamin B6 and then measure your levels over time. And you can do this pretty easily now. And like that's the key with health optimization medicine. When I started with is that we're measuring these kinds of things. And so if somebody comes in with GABA deficient kinds of symptoms, then I'm not looking at just giving them something that's going to enhance their GABA system directly. I might do that immediately, something like TroCalm or maybe like TroZZZ for sleep that we'll talk about. But my bigger plan, my bigger idea, of course, is what's the framework here that we're looking at to help support the system. And so the amino acid that's important for this whole process is glutamine. And glutamine is an amino acid that's in many types of food, but it's mostly in animal sources where it's much more highly bioavailable, for example. So if you're a plant-based person, it's hard to get enough glutamine, for example. And glutamine is actually the major fuel of your colon cells as well. So if you have a leaky gut, for example, you're going to need more glutamine, and you're going to not be able to utilize that glutamine in the body because the colon is going to be trying to use it. And then if you have an injury, if you have like a surgery, your body needs a huge amount more glutamine to help with the waste that happens. You lose a lot of glutamine when you have these kinds of inflammatory types of stresses in general. So glutamine, when it gets in the body, so by the way, you can measure glutamine levels too, which is something you can do by looking at plasma or urine amino acids, for example, which we do with the work that the health optimization framework. So you can look at glutamine, and then glutamine is then converted to glutamate. And you can also have glutamate containing foods. The most famous is the lovely MSG. Everybody remembers MSG from their Chinese restaurant days, and it's sweeter. It makes the food a little sweeter. And so I don't know if this has happened to you, Matt, but it's happened to me where you have food with MSG in it, and all of a sudden you get a headache right afterwards.
Mm-hmm. Yeah.
Has that happened to you?
Yeah, it has. Yeah.
So glutamate does is it goes into the brain, and then again, it's this excitatory neurotransmitter, and all of a sudden you have all this glutamate that your brain has to deal with, and you're going to feel irritable. You may not sleep very well. You'll get headaches because you have all this sort of excitatory stuff. And then if you're not converting very well from glutamate to GABA, again, we talked about those reasons why you might not. There's other reasons too. If you're highly stressed all the time, you're going to deplete your GABA levels as well. If you have infections, you're going to deplete GABA. If you're mineral deficient, not just with magnesium, but also with copper and zinc, you're also going to be GABA deficient. And so there's lots of reasons why people may be GABA deficient. And so you're getting the glutamate in, and then you're converting it to GABA, but then do you have enough GABA around at a baseline state if you're already always stressed, right? So, but the problem, and to go back to TroCalm, is that the problem is that GABA supplements directly don't work because GABA is a very large molecule. And as a result of being large, it doesn't get across the blood-brain barrier very easily. Triple B, so I don't mess up that again. I always mess up the blood-brain barrier. Anyway, so because if that barrier is leaky, however, those GABA supplements actually may work. So GABA supplements don't work unless you have potentially a leaky gut, which then will have, unfortunately, the likely repercussion of having a leaky brain, which just means that, and that sounds scary, but that just means that things are getting across that blood-brain barrier that should not get across as well.
Yeah, that makes total sense. I've actually experimented even recently, I think this year, with GABA capsules. And yeah, serving size, 1 capsule, take 1, don't feel it. Try 2, don't feel it. Try 4, no effect.
Yeah,
I can say they definitely don't work in my experience.
And that's actually a good thing. That means that you have an intact blood-brain barrier. Now, there may be, like with huge amounts of GABA taking orally, you may be able to get some through. And then also, just to I think that if you have a nanoliposomal variety, if you have something that's very, very, very much encased in a nanoliposome, in the case of a product like that, that may be able to get across the barrier as well. And so some products that are nanoliposomal may also work. But in general, your regular GABA supplement that you're taking for sleep or for anxiety or for stress is very unlikely to be helping as much as you think it might be helping.
And I think before we hit record, we were talking a little bit about Phenibut, which is not allowed to be sold, by supplement companies. And I think you said that's GABA attached to phenylalanine.
Yeah, it's a phenol. It's maybe just a phenol group. I have to look it back up, but there's a group. There's something attached to the GABA molecule. And the cool thing about TroCalm, it has something that I was mentioning earlier, is nicotinol GABA, which nicotinol GABA is a vitamin B3 attached to a GABA molecule. And when vitamin B3 is attached, it can get through the barrier, the blood-brain barrier. And as a result of getting through there, what happens as it gets through is it actually hydrolyzes or breaks apart into vitamin B3 and to GABA itself. And so vitamin B3 is great for the brain because it's going to cause some mild dilation of blood vessels, but it's also going to increase your NAD reserves a little bit. So you're going to have a little bit more energy. And that's great because TroCalm is there to kind of help take off the edge, but you don't have to feel tired if you get the dosing right. And if the dosing's right, you'll feel that you have just the edge taken off. It's really common, right? And people have this feeling where if they're super stressed, their brain stops working. Their mind goes blank. I'm cooking dinner downstairs and then you hear a blood-curdling scream from your child upstairs. You're like, what the fuck just happened, right? Everything you're just doing is your mind's blank. You have no idea what's going on. And, it's fight or flight mode. It happens when you're driving and something happens. Or, there's so many other examples. You're about to give a talk and you forget all your lines because it's in front of people that you're scared of or whatever. So, but if you can just take the edge off just a little bit, then your brain starts going back online. It starts actually functioning. And as a result of that, you can remember your lines and you can flow. And so that's what's really nice about it. And all of our compounds, all of our formulas are made in a buccal troche, which is a dissolvable lozenge that goes between your upper cheek and gums. Now, you can swallow all of our stuff too, but it's much better to use it as a buccal if you can, especially in a pinch, especially when you really need that relaxation, that anxiety inducing thing to be not as anxiety inducing, right? So, and to be very quickly, of course. And what's nice about that is that the troches are scored, which means you can take a quarter or a half or a full, and you can find your dose and take that edge off, and without feeling like you really need to go take a nap or just relax on the couch. You can certainly do that with TroCalm. The higher doses of TroCalm will make you feel more relaxed, less focused, and it kind of gives you like the one beer or one glass of wine effect where you just kind of feel like things are just slowly wrapping up and you feel calmer. And what is alcohol actually, but actually affecting your GABA receptors? The problem with alcohol is that there are only problems with alcohol pretty much. So in the way it affects your sleep and the way it affects your liver over time, of course, and the rest of the body. Are you a drinker these days, or what's your story with alcohol?
I'm not. I tried with the red wine and I tried every stack. I'm always experimenting with supplements and combination to mitigate all these different things. And I actually interviewed the founder of Z-Biotics, that it's a genetically engineered strain that prevents the breakdown of alcohol into acetaldehyde. And I would stack that with what's that? There's another supplement that protects the liver from alcohol.
Or milk thistle.
Dihydromycetin or something like that.
Yeah,
something
okay. That's I think the active ingredient in milk thistle, I think.
I think so. Yep. Yeah. I would take those two together and then, some Kintone, magnesium, all these different stacks. And I couldn't mitigate it. After a few weeks of just a small glass every night, wrecked my sleep. So yeah, I average one or two probably, every 6 months now, something like that. Just if I go out, sure. I'm able to manage it and kind of regulate myself and not go overboard. Some people can't do that, which I think not drinking is the best option for that.
What's interesting about those people is that they come into probably multiple varieties, but one of the varieties is actually they might be GABA deficient, and they're trying to balance out their GABA levels. And in alcoholic families, there is some evidence that there is some GABA deficiency going on. And so they're using alcohol as a way to increase the amount of GABA produced so they can feel normal kind of deal. And so it's a big deal. I mean, so alcohol binds very, very tightly to the GABA receptor. It binds on another site. So there's the receptor itself has it where GABA binds. And then there's all these other sites on the GABA receptor itself called allosteric sites. And some of those sites are very tightly bound by their molecules, like alcohol, for example. Alcohol, benzodiazepines, barbiturates, quaaludes, those aren't around anymore, but those were famous in the 1970s, bound very tightly to the GABA receptor. And that's why they have such a high risk for things like withdrawal and tolerance and addiction and dependence. But I mean, it's interesting to think of with addictive capacity as far as the alcoholism goes, that some of these people might be doing it because they're trying to balance out their GABA levels, interestingly enough. So, but wow. Thankfully, there's much better ways to balance out your GABA levels than drinking alcohol, for sure. But I mean, when it comes to alcohol in general, unfortunately, most of the work that's been done over the last 5 or 10 years has shown there's really not a whole lot that alcohol does that's beneficial. I mean, we were thinking that it was the resveratrol for a little while, but we know how much actual resveratrol is in wine and how much you'd have to drink to have any major effect there. We used to think that it was helpful from an antioxidant perspective and maybe causing a little bit of positive hormetic stress on the system, but that really isn't the case anymore either. And then there's, of course, the issue with brain shrinkage as well. Nobody likes shrinkage anywhere, especially the brain. And so, yeah, alcohol is really, and it trashes your sleep. And it really does. And that's the challenge with a lot of drugs that are available for sleep and for anxiety and things like that. They actually trash your sleep. Like, so benzodiazepines trash your sleep architecture. Ambiens and the Z drugs of the world also trash your sleep architecture. Which what I mean by that is like with sleep architectures, you have your REM sleep, which is your rapid eye movement sleep, is when you dream, and you have your non-REM sleep, which is when you're not dreaming, but when you get a lot of your restorative sleep. And there's 4 stages of non-REM. There's stage 3 and stage 4 are the 2 deeper ones. That's when you can consolidate memory. That's when you actually prune things off your memory too. And it's really important for mood regulation. And lack of that is associated with dementia. It's associated with mental health problems. And all of the drugs that I mentioned, alcohol, benzodiazepines, sleep drugs, even THC, actually decrease your deep sleep. So you have to be really thinking about these things when you're looking at how you're going to compensate for some challenges that you might have.
What about Benadryl, the antihistamine?
Yeah, so Benadryl also affects the sleep architecture as well. So as an antihistamine, the Benadryl itself is interesting, right? So it's got Benadryl is a non-selective histamine blocker. So it blocks histamine from an allergy perspective, which is the H2, and then the H1, which is more like the sleepy one. So in general, I think if people have a hard time, if they're on this cycle where they just need to break a bad sleep train that's going 100 miles an hour with crappy insomnia, and then sometimes you just got to take these kinds of things just to do that. But thankfully, actually, I think that there's better alternatives now. And I think some of the compounds in a couple of our formulas can be really helpful here. But I think I also am very realistic. And sometimes you just need to give something that somebody can just get some shut-eye, some sleep at all. And then from there, hopefully can build back and find ways to naturally enhance their sleep patterns. Of course, sleep routines and obviously not just taking something that's going to every night and not having a sleep routine and is not a good idea. But yeah, I'm definitely thinking always of how something's going to affect sleep architecture.
I love it. Yeah, and you were telling me kava, valerian, then an ingredient you added to the TroZZZ, agarin. Those are some GABA boosters, right? Those are 3.
Yeah, so we can just go through them because I think they're interesting. I mean, so kava, which is in our TroCalm formula, people know kava these days as well. There's kava bars. So kava is in kava bars because it makes you feel slightly drunk. And why is that? Because it's affecting the GABA receptors. But the good news on kava is that the research is pretty clear that it's safe. And there was some concern about it about a decade or so ago that it might cause liver issues, but there really is no indication that that's the case. So people can be, I think, calm in that capacity and knowing that you're going to be okay there. But kava does, it actually has a site on the GABA receptor where it binds that increases GABA production or increases GABA binding to its receptor. And so to be clear, what that means is that if GABA binds to its receptor, if you have a neuron that's firing, and so let's call that your presynaptic neuron, that's what it's called, and you have your postsynaptic neuron, which takes that signal and does something with it. And so the postsynaptic neuron, if it has GABA around, GABA binds to the receptor and prevents that neuron from firing postsynaptically. So as a result of that, you're decreasing or stopping the firing of that postsynaptic neuron, and you're calming the firing down of the brain. So let's just be clear, that's what GABA is doing when it binds to its receptor. It's opening up this pore in the middle that allows chloride to go through, and then it has this reaction that causes it to actually hyperpolarize, which means that it won't fire if signals come to it. So that's the mechanism there. So when it comes to kava, to go back to that, kava is binding a site on the GABA receptor. GABA is binding as a result of that more tightly, and then the GABA receptor pore is opening, causing the hyperpolarization and preventing that neuron from firing. So just to give the whole thing there to give people a feel. So kava does that, and also has some additional properties as well. It also probably works on the dopamine and norepinephrine system a little bit as well. And so as a result of that, kava doesn't tend to make you feel as tired as well as some of the other ones that are being used for sleep, for example. So kava is really good for anxiousness. It's good for stress. It's good for taking the edge off. It's good for quieting the mind a little bit too, but it's not potentially a sleep remedy for most people. So you have kava there. You also have something like valerian, and you mentioned valerian. So valerian's not in our products, but valerian's another one that's also very well known to help with sleep. It's also working on actually the benzodiazepine site of the GABA receptor. So where the benzo would potentially bind is where valerian does, but not as tightly, and it doesn't give you the same risk profile as you would if you were taking a benzo. And so valerian can be very helpful for sleep in some people. And then you mentioned, yeah.
It has given me nightmares sometimes, though, and I never figured out why. And valerian's the only sleep, I don't get that from melatonin or anything else. So it's interesting. I wonder
if it's because it's not the actual active ingredient itself. It's actually, so typically and this is the reason we don't use it in our products, is that it's very difficult. So valerian root is not just going to be the active ingredient in valerian, which is valerianic acid. And so valerianic acid is a GABA A receptor agonist, which is what we're talking about here. But it's not just valerianic acid that you're getting valerian root, which is going to be a whole bunch of other compounds that some of them have been well described, and others. So actually I avoid valerian for that reason too. It gives me nightmares. I don't take it. So I don't take it as a result of that. So interesting that you've had the same thing. That's cool. That's very interesting. So, and we also have something in there called, in our sleep formula called TroZZZ, a compound called agarin. And agarin is a compound that was first found in the fly agaric mushroom, which is the Amanita Muscaria mushroom, famous in Alice in Wonderland, famous as the mythological birth of Christmas and Santa Claus. The idea would be that reindeer urine would be drank by shaman, and these shaman would have psychedelic experiences, and then these shaman would share their urine with their people that they were taking on psychedelic experiences. And the reason why they had to drink urine here is that the mushrooms themselves have two compounds in them. One of them is called ibotenic acid, which is the one that causes the hallucinations and psychedelic experiences for the most part, is also neurotoxic. And so the neurotoxic experience is a psychedelic experience. And the other ingredient there is called agarin. There's others, but these are the two main ones. And agarin is a GABA agonist, which means it enhances the GABA system. It actually binds directly to the GABA site, which is pretty cool. And the other thing cool about agarin is that the half-life is long. It's about 8 hours. And so it gives you the ability to take something like in TroZZZ in our formula and have a consistent amount of GABA in your system throughout the evening. GABA helps us regulate our sleep. It helps prevent us from waking up during our nightmares, hopefully not on valerian, but during our nightmares, we don't act them out. One of the reasons we don't act them out is that what can happen during those nightmares is that you get certain neurotransmitters that get released, like norepinephrine, and especially because the body's like getting chased by a lion or a bear or whatever, but you don't wake up. And one of the reasons why you don't wake up is that you have enough GABA in the body, in the brain, so that you're suppressing that excitatory stimulus of the getting chased by the bear kind of thing.
Freddy Krueger.
Yeah, Freddy Krueger, Friday the 13th, good timing. And so having enough GABA around, the people that wake up in the middle of the night, the people that wake up at 3 o'clock in the morning and can't go back to bed, these are people that typically have either too much norepinephrine around or too much cortisol. And because cortisol spikes can happen to people at 3 o'clock in the morning, especially if you have a lot of anxiety and stress, and they wake up at 3 o'clock in the morning looking at their to-do list, and it can be crazy, right? And it'd be very difficult to fall back asleep. But if you have enough GABA around, you may not actually wake up at all. Or if you do wake up in the middle of the night, you're going to have enough GABA around that you're going to be able to fall back asleep because you're going to be sleepy enough because there's enough GABA to be able to keep you and maintain your sleep. So this agarine compound is super cool because it has this ability to bind to the GABA receptor. It has a very interesting history, of course, and it's got the Amanita and the psychedelic stuff there, but that's not why we're using it. And we're using it at very low doses. So in our product, there's only 1 milligram of agarine per troche. And the average dose so far for most people is about a half of a troche, which is kind of common for us with our products. And so you're only getting a half a milligram. So we keep it super low dose and it's super clean. There's no ibotenic acid at all. It's completely created and made and very pure agarine in the formula for that reason. Yeah. And
no deer urine in there.
No. And the reason for the urine, by the way, ladies and gentlemen, is that the urine would detoxify the ibotenic acid. So it wouldn't be as toxic to the next person that drank the urine kind of deal. So the story goes that these people would watch reindeer eat these mushrooms in northern Scandinavia and go into like psychedelic experiences, these reindeer. And so I think that's how these people got interested in these mushrooms themselves, but realized they couldn't take them directly because they were toxic and make them vomit. And so the Amanita mushroom doesn't kill people, by the way. It just gives people a very like nauseated, vomiting, diarrhea kind of experience. So it's not one of those mushrooms out there that you go forage for and end up with liver failure and die. It's just one of them. It's not, you're psychedelic, but you're also vomiting. Maybe it's like DMT. I don't know. But anyway, that's another story.
And you mentioned Santa Claus. It's because it's red with the white dots on it, right? So
yes,
Santa's costume, red and white, right? It's
right in the reindeer, right? So that you were in northern Scandinavia, you were taking it where the reindeer were, and then you were watching flying reindeer, and this mushroom turned into like a big, large man that looked like the mushroom. So it's really cool lore, and it's interesting that we've used it in our product, and we're excited about it actually, because I think the thing about agarine is that it does really regulate the nervous system, and it can do it at a very low amount milligram dosage. And so we're playing around with it in other formulas going forward, because I think that there's going to be reasons to use it even maybe during the day if it's at low enough a dose that you can prevent some of the anxiety and stress that might pop up throughout the day, because you have like a baseline where your mind is more quiet. And if your mind is more quiet, that's always awesome, because thoughts are kind of pervasive. So,
well, I was going to ask you about daytime dosing of this, because people would probably freak out because of the melatonin, which I think 5 milligrams is a microdose to me.
Yeah.
I take a lot more than that every night. But I'm a big fan of Doris Lowe. I think one of the owners of Transcriptions interviewed her years ago, and she talks a lot about dosing melatonin during the day as being beneficial, especially for infection. So I think I'm going to play around with taking TroZZZ during the day and see how I feel.
See how you feel. I mean, I would start off with just really the smallest dose, either a quarter or even an eighth of it, to see how you do. And you make up a really good point. So in our TroZZZ formula, we do have some melatonin in there, and there is some controversy on melatonin. And I think, my sense of this, doing the research and working with patients for many, many years, is that I do feel like you can do a lot with resetting your circadian rhythms by making sure you see the sun rise in the morning, sunset in the evening, wearing your blue blockers and watching your screen time and doing all of that. But as we get older, as about around the age of 50 or so, our melatonin production does go down regardless of all that stuff. And so I think that there's utility, especially if you're over that age or getting close to it, as a way to help maintain melatonin production, alongside, of course, knowing that melatonin is a fantastic antioxidant as well. So it's one of the most important antioxidants in our mitochondria.
I think you follow my stories on social media. Recently, I posted one of my little coffee pours. It was like the Oxford University professor, Russell Foster. He said that the blue light at night isn't enough to suppress melatonin production, because I know that's a really trendy thing in the health community. And I think there's absolutely benefits to yellow tinted glasses and orange or red tinted glasses. But his point, and he backs this up, that the latest studies, they couldn't repeat the old results of, like the light behind the knee suppressing melatonin. And he was saying those are all invalid and we're still running with those. I thought that was fascinating because like nobody's talking about that right now.
Nobody does. Yeah. But because it's too nuanced of a conversation, because in general, screens with blue light in your face are not a good idea for a lot of different reasons. Mm-hmm. What it comes down to, though, as far as my understanding of the research here, Matt, is that what's most important is actually the lux. So how bright the light is more important than the actual spectrum itself. So if you have a choice of bright light or much more not bright light, the opposite of very dull, or what's the opposite of bright, is very low light. Dim. There you go. Like what's the opposite? So dim light is always going to be better. So, and that's what I always tell my patients and clients. I'm like, look, it's not that difficult to get some yellow lenses or orange lenses. I think that there's no harm in those, but I think also it's really important that you don't want to have massively bright red lights in your house either at night either. So, but there is some controversy on melatonin production and blue light. I'm familiar with that. So, and I think it's important that people realize that. But at the same time, I think it's also easier to say, look, this is going to be helpful for you. Very likely, it's going to have you probably be doing less screen time at night and less overall stimulation. Because, I mean, the key always is you want to have a sleep routine here. You want to have a way that you're winding yourself down every night. I like to think about it as like your Pavlov dog response. So for people who don't know Pavlov and the dog, it's if you have a bell and you have food for a dog, the dog salivates before the food comes. And then you take away the food and you just ring the bell and the dog salivates, because the dog has an automatic response to the bell. And you can think about many different ways you do this in your own life. And I had a dog, for example, that I just say go, and then he would know that we were going outside. And so you can have very different ways of doing this in your own personal life with relationships and see how these triggers work. It all works interesting ways, how people have these reflective responses. But for sleep, it also works too. And this is one of the big things I do with all my clients is like, what are the 30 minutes before you go to bed every single night? And you should do the same exact thing every night before you go to bed for at least 15 minutes, if not longer, to just say, okay, your body's like, this is what I do before I go to bed. And I'm going to bed every night this way. Yep. And it's supremely helpful overall. Mm-hmm. But if you're traveling or if you don't have that capacity, then that's when things like these sleep augmenting realities will help you, right? Where you have things like TroZZZ that might help you, or other kinds of supplements that may help you relax you, ways that you can help navigate time zones. Like melatonin, for example, as much controversy as there might be, when you're changing time zones, there is very little controversy that melatonin can be helpful. And so when you're doing overnight flights and you're going into different time zones, even if it's not a huge amount of time zone, even just a couple hours, can be really beneficial to help signal the body to help you start getting ready for sleep. And that's what melatonin is really for, and then it helps with maintenance of sleep as well. And some of the people that wake up at 3 o'clock in the morning is because their melatonin production is not keeping them throughout their evening as well. And another reason why people may wake up. So I think melatonin is the other thing that's been in the socials and popular press is that somehow melatonin decreases testosterone production. And there's absolutely no evidence that that's the case at all, especially at physiologic dosing that we're talking about here. Now, there may be reasons to do super physiologic dosing of melatonin for things like cancer, which is used by some of my colleagues around the world. And I think that's fine. And I know there's other people that are proponents of high dose melatonin for antioxidant purposes. My sense is that that's likely okay in the short term, but probably not a great idea over the long term. But we certainly have melatonin in the formula. And I do understand that people do have a interesting relationship with it overall.
Yeah, I took the oral, I think it was the powdered form, 1,000 milligrams was my max so far. And it was interesting, the next day, no sleepiness first thing in the morning. I mean, super alert, but I felt kind of like I was coming down with something and then it passed. So it's my experience with melatonin is like very detoxifying. It's not like it makes me sick and I stay sick and I have to work. It's like I feel like it's stirring some stuff up. I don't know exactly if it's, working on dormant viruses. And yeah.
So it's going to help mop up free radicals and oxidative stress. And so that's why it's actually being used in a lot of these. It was previously during certain times of a certain pandemic as an additional thing that people were using along with other antiviral strategies, including things like methylene blue, like we talked about before. But melatonin was part of that because it's an antioxidant. So it's going to help mop up free radicals and antioxidant, and that's what antioxidants do. And that's sometimes when people have like a detox symptoms, like you talked about, you felt like you were coming down with something. That's often the body's response to some sort of insult, oftentimes an infectious one or inflammatory one. And so we're not actually feeling the inflammation itself all the time. We're actually feeling the reaction of the body to the inflammation or infection. So like a cold, for example, your stuffy nose, your nasal congestion, your coughing, that's not the infection itself. That's the body's reaction to getting that stuff mobilized and getting you better. So that's why you don't want to, this is kind of a little bit of a side note, but helpful for people. That's why you don't want to use antipyretic strategies. You don't want to potentially decrease your fever if you have an infection, unless it's very, very high. In general, you want the body to react by increasing the body's temperature, because that's how it kills shit. And if you're taking Tylenol or Advil every 6 hours to decrease your temperature, you're not going to do as good a job at mitigating those things. And so that's why it's really important to let the body have its path, do what it needs to do, support it, but don't try to make too many shortcuts along the way, and just start feeling better so you can go back to work. I mean, we evolved to have fevers for a reason.
Mm-hmm. Going back to, you were talking about associations, and I had a friend recently that lives here near me in Idaho, and he was experiencing insomnia, had a new baby, and just, that's insomnia that comes with that. And I gave him my Sota biotuner, and I was giving him some tech, to do some electric stimulation to his brain. And eventually, and it helped, but he said the thing that helped the most was just letting go of trying to get back to sleep, like just the mindset shift of just surrendering and just being okay with being, just looking at it as relaxation time instead of insomnia time. And just that reframing helped him cure that kind of insomnia.
Oh, absolutely. I think that, and that's why one of the main conventional strategies for people with insomnia is cognitive behavioral therapy, CBT. Mm-hmm. And it is effective. It really does help people reframe and understand that there's another way of thinking about being up in the middle of the night. And look, I've had 4 kids, and I understand what it feels like. But the most difficult is going 0 to 1, typically, when you're used to sleeping a certain amount and going to bed and having your own time. And yeah, it can be challenging. People, women, of course, have postpartum depression, which is partially hormonal. But men, have postpartum depression too. It's a real thing. It's not hormonally related. It's related to the significant change in their entire world. And interestingly, as we're talking about GABA, the first drug for postpartum depression was just approved by the FDA maybe a couple of months ago now. And it's a GABA receptor agonist. So it works on the GABA system. And they're still giving SSRIs to these women. But SSRIs, as we know, if they're going to work, they take about 4, 6, 8 weeks to actually work. And many people listening know about the controversy about SSRIs and whether they're really working on depression exactly, and they're not. They're working on they're elevating mood, but they're not really dealing with anything that's underlying, is what it comes down to. But the GABA system, when you have GABA floating around, when you have something like a GABA drug here, you're increasing. Sorry about the dog, everybody. So We'll stop in a minute, I hope. But so this drug specifically targets the GABA system, and it works immediately. So instead of having your 6-8 week of having to see if the drug is going to work, this drug works immediately for postpartum depression. And so you're going to be seeing more drugs come out in this category. This is the first one that's come out that's just affecting the GABA system, but it's just another sort of thing that makes me aware and makes, as a clinician, like, look, we can really be targeting the GABA system more and seeing significant benefits for anxiousness, for stress, for people that have, depression, that people that can't sleep, that people have, significant mood lability. There's something there. There's another piece of the GABA puzzle too, is that the GABA itself, so GABA neurotransmitters, the ones that have the GABA itself, are in a place they're all over the brain. They're all over the brain. And in the brain, they work as something called an interneuron. So they're between these neurons, and they're extremely important for regulating memory, for processing, for learning. And what they're doing is that they're actually helping gate your dopaminergic and your serotonergic neurons. What I mean by gate is they help kind of prevent certain things from firing and regulating the flow and helping modulate the flow, so you can actually learn things and you can actually process things and you can actually store things in your long-term memory. So it's kind of amazing that this GABA receptor is in all these locations. And then depending on where it's in all these locations, the receptors have 5 subunits. And so those change depending on where the brain they are. Some are more focused on anxiety and stress, some are more focused on sleep and things like that. So you can modulate these receptors in various locations and work on various things like anxiety and stress, or sleep, for example, right? And so, and you also have different types of GABA receptors called GABA B receptors. Everything that I've been speaking about here has been GABA A for the most part. GABA B these are receptors that are mostly in the spinal cord. These are great for like muscle relaxation. So your medications like baclofen, GHB actually is a GABA B receptor. So GHB is well known. It's also in the brain. There's GABA B receptors in the brain too. And GHB gets a really bad rap as the date rape drug. But I actually interviewed somebody recently on GHB, and it's actually a drug that's used for narcolepsy because people can sleep better night when they take GHB, and then at night and during the day they have less narcoleptic episodes as well. GHB was developed for many reasons, but it's actually an approved drug for narcolepsy. So it's used in that capacity, but it also is a GABA B receptor agonist. And it's going to work like alcohol would, but it's stronger than alcohol in the way it works. And so that's why it should be a prescription the way it's developed. But in essence, you have GABA A and GABA B receptors that are all throughout the brain doing various things. But what they're doing overall is calming down the firing in that particular area that's affecting the brain tissue in that particular area, or the spinal cord tissue. So if it's in a sensory area, it's going to affect sensory things. If it's in a motor area, it's going to affect motor things, for example. So you have so the nice thing about some of these compounds that we're talking about is that you can modulate the type of receptor, the GABA receptor, where it is, depending on the compound. So for example, you have something like what's a good example? So which one would be the best one to talk about? So you can talk about something like one I didn't talk about, one called honokiol or honokiol, is how some people will pronounce it. This is from magnolia bark, and that's also in the TroZZZ formula. So TroZZZ formula, this specific one, and honokiol specifically, is going to affect areas of the brain that are most important for sleep and for sleep induction and for sleep maintenance, as opposed to something like kava, which is going to be more affecting the areas of anxiety and stress in your brain.
Okay.
So it's more targeted, which is interesting. So you can look at these various compounds and say, okay, so honokiol or honokiol is going to affect more of the sleep areas of where GABA is going to bind. And then you have the kava will bind in different locations. And so then, of course, if you're giving GABA itself, so nicotinol GABA, remember, GABA supplements don't work, but nicotinol GABA or the agarine, which affects the GABA receptor itself, that's going to be more widespread. So that's just something to be aware of when you're taking these various compounds. And that's why TroCalm was developed, to have the various components that are affecting the GABA system not be affecting the sleep system as much, as opposed to the TroZZZ formula, which is formulated to affect the sleep systems in the brain more prominently to help you with, obviously, with sleep. And so that's the delineation for us. We were very specific about how you kind of navigated the GABA system in this way. And so TroCalm is great. You can take it during the day. If you have a low enough dose, you don't feel like you're tired. If you want to take a bit larger dose, you can. You will feel slightly more sleepy, and you also have your mind going more quiet, which is nice. And if your issue, actually my issue, is that I have a hard time falling asleep sometimes, and if that's your only issue, and once you get to bed and you're good, that's my thing, then I take TroCalm before I go to bed, and my mind is more quiet. I just go to bed and I fall asleep, and I'm good the rest of the night. I have many years of waking up with children and going back to bed. I have many years of waking up at the hospital and going back to bed. So I've been trained by my children and by hospitals to be able to go back to bed very easily in general, most of the time. So that's nice for me. So TroCalm's great. I just take TroCalm an hour before I go to bed. I'm good. But TroZZZ, for example, for me, doesn't work it's not as necessary for me, because I'll fall asleep and stay asleep but especially for people that have a hard time staying asleep. TroZZZ is great, absolutely great, because they can maintain, or if they do wake up, they'll have that agarine on board, so they'll be able to go back to bed.
Wow. So which ingredients in TroCalm and TroZZZ are, work on the GABA B receptors?
These are just GABA A, actually. We'd have nothing that's working.
Okay. So I have to get GHB. No, I'm just kidding.
You have to get GHB, yeah. Well, there's actually a racetam. I think it's called phosphoparacetam, that also works on the GABA B receptors as well. So that's another one you can chat and see if you can source. But the other thing you have to worry about, or just be considerate with GABA B, it also is a muscle relaxant as well. So a lot of the muscle relaxers have GABA B function or GABA B action. And so that's something you have to be aware of. And so that we use, like, in people that are paralyzed, that have like a quadriplegic or paraplegic, they'll have a lot of spasms in their legs because the nerves don't fire anymore. And so we use the GABA B drugs to help prevent the spasms that are happening in those patients. So GHB is a little bit more, a little bit less specific. So it does work on receptors in the brain, but it does cause some muscle relaxation as well. So you have to be careful with that one. The GABA A ones don't tend to do that as much. So that's why we were more focused on those in our formulas.
Is there any relationship to restless leg syndrome with GABA? Or
nobody knows what causes restless leg. It's one of those unknown ones. So for me, when I have clients with this, what I think about is obviously optimizing their diet, their lifestyle, their supplements, doing testing to look at if they're vitamin deficient, because oftentimes certain vitamin deficiencies can cause neuropathic anxiousness. They can cause like neuropathic tremors, a little bit so they can cause like little spasms and things like that. So certainly making sure your B vitamin optimized and not over optimized, the things like your vitamin B6, like you talked about before, it's really important. And then stress is a big one for people. And so working on stress is a big one. And it's hard to know. There hasn't been any studies on GABA specifically for this, and we haven't started working on it specifically with TroZZZ, but I have had reports with TroCalm that their legs don't move as much when they use TroCalm before bed. So I'm interested to see how things work on the TroZZZ side too, because I'm almost positive that there is a GABA component to this for many people. And it might be a GABA deficient component, meaning that they don't have enough GABA floating around and they need more so that those nerves don't continue to fire when they're sleeping. Because what's happening for people with restless leg is that they have a tremor, like something's happening in their arm, in their leg. Usually it's in their leg, obviously. That's why it's called restless leg. But we don't have a good sense of the pathophysiology of that entirely. But I think it's worth a shot for sure.
Yeah. Scott, I wanted to circle back on, how do you pronounce it? Agarin or Agarin?
Agarin. Yeah.
Circling back on that, what have you found, like the LD50 on that, or what's the dangerous, like, is it like 100 milligrams per kilogram of body weight, or what's the?
Right. Yeah. So we think that from the research out there, somewhere around 10 to 15 milligrams of it is going to cause it may cause hallucinations. You may have a psychedelic experience on it, but it won't be like being on the Amanita mushroom, because that's really the ibotenic acid. Mm-hmm. It might be more like taking a very high strength Ambien kind of deal. We're not really sure. The LD50 is likely very high, but the issue is with any high dose effect on the GABA receptor, you worry about respiratory depression. You worry about stopping people from breathing, because if there's too much GABA around, that will happen. This is what happens with people that go into alcohol-induced comas, for example, where they take too much benzodiazepines and Ativan, Xanax, and Valiums of the world. And so you can stop breathing, which is obviously not cool. So I don't know what that dose is, but certainly over that amount, that's why we kept it very, very low for people. And that's why, we don't allow more than a certain amount to be sold actually on the website, is one of the reasons, at least, is that we just want to make sure that we are just being very careful with this and for people. But if you're a clinician, if you're listening and you're a clinician, you have a clinical practice and you're using supplements and formulas in your office, then we don't have any limits for you to buy it for your office. You can buy and you can be in control of how much your patients get and then how they get it and things like that. So, but from as a company and as clinicians ourselves, there's 4 docs on the team, including me. What we want really is to give people safe, effective, precision dosed formulas that are really going to help them, and that we can help our clients and patients with as well. That's the whole idea with this, circling back, is that we wanted to make things for our clients that can help them now while they're on the longer path of optimizing their health. And one of the major things that people need is they need to sleep now. They need to focus now. They need their anxiousness to go away so they actually can function. And then, sleep is such a huge cornerstone thing. If you don't sleep, your immune system sucks, your relationships suck, and your ability to have a even temper is like none. And they've done these studies as well, sleep deprivation equaling how many drinks of alcohol that you've had. I don't know the exact equivalence, but if you've gotten 4 hours of sleep, and you're waking up in the morning, it's like you're on 4 beers or something like that. So it's kind of ridiculous how much sleep affects us. And so having good strategies is really important overall, but knowing what you can use in a pinch, or when you're on a process where you just need to break cycles, don't mess, and you don't want to mess with your sleep architecture as much. The ones that we've created can really be helpful. And actually there's one ingredient in TroZZZ that I forgot to mention called cordycepin. And cordycepin is one of the active ingredients in the cordyceps mushrooms. And cordyceps mushrooms are famous now from a show on HBO called The Last of Us. And this is a zombie apocalypse movie or a series. And the cordyceps mushroom does infect insects in their brain and takes over their brains and makes them zombies. So that's how they got the idea for the show. I think it's based on a video game, as far as I think I'm remembering that correctly. But cordycepin, which is one of the active ingredients in cordyceps, has some indications that improves slow wave sleep. So it improves deep sleep. And there's also some metabolic effects to it that are really interesting, improving insulin sensitivity. And also, interestingly enough, there may be some roles in cancer treatment. And this is being looked at now at very high doses of cordycepin. So very intriguing compound overall. So we're using it as a way to enhance slow wave sleep in the actual formula. So yeah, overall, we're trying to find a comprehensive sleep formula for people that help with induction, so helping you fall asleep and feel sleepy, helping you maintain sleep, and helping you wake up feeling rested, provided you have a window of sleep of at least 6.5 to 7 hours, ladies and gentlemen. Nobody should feel rested after 4 hours of sleep on most anything, I think, overall. So
maybe if you sleep in a hyperbaric chamber, right?
There you go. Yeah. But I don't recommend that. I don't recommend sleeping in a hyperbaric chamber. Not a good idea in general. One off here and there, okay, but in general.
And you also have adenosine in here, right? Is that?
Yeah, that's right.
Is that like adenosine triphosphate? Is there
it's the same thing. So adenosine is it actually works in our formula as a neurotransmitter. So if you drink coffee, which I know you do, Matt, and so Matt and everybody else drinking coffee out there, so adenosine is it's a neurotransmitter. So when it binds to its receptor, it makes you feel sleepy. So adenosine also comes in lots of different forms: adenosine monophosphate, triphosphate, AMPK. A lot of adenosine is also it's something that is part of your nucleoside. So it's in your DNA is adenosine as well. And so it's in a lot of different places, but in the form that we're using it, it's being used as a way to unbind anything that might be sticking onto that receptor that's keeping you awake. And so for most people, that's going to be caffeine. So adenosine kind of outcompetes caffeine for the receptor itself, and then helps you, as a result, fall asleep faster. So it's a very short-acting molecule, and where it's not not around for very long, but we're really using it in people that like to drink coffee and helping them with their potentially the coffee that they took too late in the day and still feeling a little bit jittery or so. Having adenosine in there will help with the calming down of the nervous system because adenosine will bind to its receptor and make you feel sleepy.
Awesome.
So
awesome.
You have the complete formula being it helps you with induction, so it helps you fall asleep feeling sleepy, it helps you maintain sleep, and helps you wake up feeling rested. So it's the whole shebang. It's the Mercedes-Benz of a potential sleep formula in that capacity. So yes,
that's
but
great.
If you just have trouble falling asleep, as I was mentioning, TroCalm can be great for that because it's going to help quiet the mind and help calm down your thoughts. It won't make you feel tired per se. And TroCalm for me doesn't make me feel tired. Even a full troche doesn't make me feel tired. For some people, it definitely will, but for me, it doesn't. It just helps quiet my mind. So I'll use it when I travel in combination with methylene blue, of course, to help support your mitochondrial function. But I'll use TroZZZ when I get to my location now. And it's been really great to help with that, with the circadian and time reset piece of all of this too, which has been fun.
That's awesome. And don't have much time left, but you guys recently also released kind of a larger dose methylene blue, right?
Yeah, we did. It's called Tro Plus Blue. And this is for practitioners only, though. It's not being sold to the general audience because when you're using higher dose methylene blue, you want to be thinking about more understanding exactly why you're using it and for how long you're going to use it for. High dose methylene blue in this area, somewhere between 25 to 100 milligrams. So the range is in that range. And the troche itself is 50. We're looking at acute inflammation, acute trauma, acute stress, acute low oxygen states, really when you have acute and severe mitochondrial stress, because when you do, you need more support very, very quickly. And of course, infection as well, if I didn't mention that. Mm-hmm. And so when the mitochondria are really stressed, methylene blue is going to come in there and help just bypass any complexes that aren't working well in the mitochondria. It's going to mop up free electrons and reactive oxygen species. And then from infections perspective, methylene blue is going to actually produce at these higher doses hydrogen peroxide. And people get scared about hydrogen peroxide, but it's a fantastic way to kill bugs because most gram-negative organisms, most viral organisms that have capsules, that actually have these capsules, they're very sensitive to hydrogen peroxide concentrations and they'll be killed by hydrogen peroxide. So at this dosing, this is the dosing we're using for infection very, very effectively. So in people that have chronic infections, even acute infections, there's some pretty good data that methylene blue at these doses can be very, very helpful. Now, it's not the only thing you do, of course, but it's something that can be used as an adjunct for infection, for biofilm busting as well, for people that have biofilms that are pathologic, for things like Bartonella. There's been some evidence there. So typically short-term dosing, not for longer periods of time, but it's good to have in a pinch in an emergency, like in your medicine cabinet, like having high-dose methylene blue there when you think you're coming down with a cold or when you have an acute insult of some sort, even a trauma of any type. I think I would be thinking about using methylene blue at these higher doses to compensate for some of the stress you're putting on the system.
Have you used it in combination with like a 2-atmosphere hyperbaric? Or
of course, yes, of course. And there's lots of different reasons why you do that, especially from the acute inflammatory side of things or the acute low oxygen side of things. And look, I mean, this is all done in my own clinical practice, and I don't recommend anybody do this stuff without talking to somebody that can help you, because all of these things by themselves have their own risks. And then of course you combine them, there's additional risks that you need to think about. But I'm actually very excited about this, Matt, especially for the acute trauma, the acute ischemic kinds of things like acute strokes and acute traumatic brain injuries and heart attacks. And of course, not forgetting the hospital and going to the hospital and doing all of that. But once somebody comes out of those places, being able to salvage tissue, I'm really excited about, especially combining these things together. But there may be even a role of methylene blue even very early on in these acute episodes of helping salvage. I mean, there's been studies in animals that if you take methylene blue at these doses and after somebody's an animal's had a stroke, the infarct size is smaller. So the size of the area that was insulted by the stroke is much smaller than it would have before. So I think that I think that nobody's ever going to do the studies on this stuff because methylene blue has been around such a long time, and there's no patent at the end of the rainbow for a $1 billion drug. But it's compelling enough that we decided to make this Tro Plus Blue. And we had so many requests from practitioners that wanted really high quality stuff that I was actually talking to a practitioner the other day. Her pharmacy can't get better stuff than we can get as far as the purity and heavy metals and all the stuff that we do. So she wants our stuff because she doesn't want to prescribe it to her patients because it's got more heavy metals in it than our stuff does.
Wow.
Their website is TroScriptions.com. It's on Instagram at TroScriptions as well. If you're looking for anything on my end, I'm at Dr. Scott Sherr, DrScottSherr. As Matt said, I'm involved in hyperbaric therapy and health optimization medicine and a number of other things. I do my own consulting with clients and patients. I do work with clinics as well, integrating all these things together. But on the transcription side, Matt, you have a code too. I don't know if you have it on the top of your head of what it is.
Blackburn.
It's Blackburn. So you guys can save money using Matt's code. Depending on when this comes out, we have lots of deals coming out for Thanksgiving and for Black Friday. And I encourage everybody to kind of take a look at those. They'll be coming out soon, or may have already come out depending on when this episode releases. So
awesome. Well, thanks so much, Scott. Yeah, always so fun. And I'm excited. I'm going to try both of them tonight together. See what happens.
Okay. Go slow. Go slow. That's what I always say. Yeah.
Take the whole box.
No, don't do it.
Well, that wraps up today's show. Always really fun speaking with Dr. Scott. I recommend heading over to the TroScriptions website and click on the Learn tab and then blog. A lot of people had questions about the PEG ingredient in their troches, and Scott wrote an article on that a few years ago that breaks it down, the difference between polyethylene glycol and propylene glycol, aka antifreeze. And in that article, he references the Oncology Times journal that actually showed that polyethylene glycol may reduce the risk of colorectal tumors by 50%. So it's not only not harmful, but beneficial. And this is often the case when I see social media posts going viral demonizing different supplements or ingredients, and then the story can flip where it's actually not only harmful, but extremely medicinal. It's always good to approach fear-based articles with a lot of skepticism, because usually there's an agenda there, whether it's a competing product or just trolls trying to get clicks. So if you want to save 10% on any of their products, you can use the discount code Blackburn. One note, if you are a fan of vitamin C, also known as ascorbic acid, like myself, take it separately from methylene blue, because methylene blue can be reduced by ascorbic acid. And you could see this if you take liquid methylene blue or even dissolve a troche in water and then add ascorbic acid powder to it and mix it up. The blue color will actually go away and the solution will become colorless or clear. So the solution there is just to take them at separate times. If you want to check out my CLF protocol and all the other recommended products that I have, you can go to matt-blackburn.com. And I noticed that protocols become kind of like a dirty word in the natural health community. I think my protocol that I put together is really gentle. It's not extreme. And most people respond well to magnesium, vitamin K2, shilajit, systemic enzymes. Most people respond well to these things. And in nourishing the body and removing some fibrosis and scar tissue, that just opens up the opportunity for the body to heal. You can find MitoLife products at mitolife.co. Our 7-stage under-counter water filtration unit just came back in stock. If you've been waiting for that, it's finally back. It's really one of a kind. My team and I built this from scratch. and it's just really easy to maintain, really affordable, and super effective. We are having a Veterans Day sale this weekend. So from November 10th through the 12th, you'll automatically save 20% when you order anything from the website. Check out the MitoLife Academy on YouTube. Just posted the Biohackers Homestead Tour last month, and that was a lot of content just walking around the property and talking about off-grid living in cold weather, and all of the devices that we use to help stay balanced out here. That is all for today's show. I'll see you guys next Friday. Stay supercharged.